Now, today is World Fetal Alcohol Syndrome Awareness Day. And according to American Medical Association Journal, South Africa has the highest rate of fetal alcohol syndrome disorders. Now, this has been attributed to the high consumption of alcohol during pregnancy. Joining us to discuss how society can reduce fetal alcohol syndrome disorder is Dr. Leana Olivier, the CEO of a Foundation for Alcohol-Related Research. Welcome to you, Dr. Olivier. Perhaps let's start with definitions. What are we talking about when we talk about fetal alcohol syndrome?
Fetal alcohol syndrome is a condition that is caused when an unborn baby is exposed to alcohol during pregnancy. In other words, if the pregnant woman uses alcohol, and the alcohol has got a damaging effect on the developing cells and the developing organs of the baby, which then leads to permanent irreversible damage, especially brain damage, and that is then called fetal alcohol syndrome.
So are there proportions as to how much alcohol a woman can consume when she's pregnant, or is it a matter of no alcohol at all?
The message, and that's based on national and international research, is that no amount of alcohol is safe during pregnancy. And I know that's a frequently asked question, is it possible that one can drink a little bit of alcohol, and what is a safe time to consume alcohol during pregnancy? But the safest answer and the way is not to use any alcohol during pregnancy. And it's also important that if there are viewers who are using alcohol and pregnant at the moment, to remember that it's never too late to stop as well.
And let's say somebody has been consuming alcohol, somebody's watching now and they're pregnant and they're saying, oops, I'm one of those who's been drinking. Is there anything that one can do to reverse the effects of that, or the effects of the alcohol would have had on the baby, that is?
Unfortunately not. The sad thing in South Africa is that about 78% of pregnancies in South Africa across the board are unplanned. So quite often women use alcohol without knowing that they are pregnant, and this is the sad part of the story. So what we always say is, as soon as you find out you're pregnant, and if you use alcohol during that time, rather stop now, and then you can lessen the damage. But sadly also the damage, there is no safe period to use the alcohol, and quite often we find that damage is being done earlier in pregnancies when women do not know that they are pregnant, because that is also the time when the organs are forming. But important to remember, no alcohol is safe during pregnancy.
And as far as the numbers in South Africa, how does South Africa fare as far as the prevalence of fetal alcohol syndrome?
Yeah, according to the World Health Organization, the estimated Fasd, fetal alcohol spectrum disorder, that's the broader term, approximately 1.5% of the world's population has got Fasd. If we compare that to South Africa, we've got communities, and that's the studies that we've done in the Western Cape, the Eastern Cape, the Free State and Gauteng, where we've got prevalence rates ranging between 2.7% to as high as 28%. So our country has the highest reported rates in the world. In fact, in some of the communities, it is 14 times higher than the average in the rest of the world. So we've got a very big problem with Fasd in our country.
And so how do you turn this around? How do you ensure that communities and women and couples are educated and informed about this?
Yes, I think the key word is education. Another very important word is support, because women carry a very, very heavy burden. We've just finished Women's Month in August, and now we're talking about fetal alcohol spectrum disorder as well. For us, when we do awareness and prevention programs in the areas that we work, and our organization has got 13 projects at the moment in the provinces that I mentioned, we always say that it is not only the responsibility of women of childbearing age or the pregnant woman. I always ask, where are the partners of these women, the fathers of the unborn children? Because women, when we ask them, of course, in a very non-judgmental way, why did you use alcohol during pregnancy? The answers range from, I did it because I was so stressed, just need to do something to help me to cope with the stress, or I was under pressure from my partner or my family or my friends, or I got mixed messages, people saying it can't be harmful just to drink 1 or 2 drinks. So there's this beautiful African saying you need a village to raise a child, but I always say you need a village to support women of childbearing age not to have children with FASD. So it's not only the responsibility of the woman.